Welcome to the Inspired Podcast, Leading the Way in Education. I'm your host, Andrea De La Cerda, and each week I'm bringing you insightful discussions and news about changes in the landscape of education and trends in entrepreneurship. As a former middle school teacher turned corporate communications executive, I'm here to share how my experience with corporate clients and as a business owner can and should influence the way we think about marketing and the educational ecosystem. We'll talk about what's working, what isn't working, and how to change the paradigm of public versus private once and for all. In today's episode, we're discussing a very important topic in education, and that is monitoring and treating the mental health of our teachers. From burnout to compassion fatigue, teachers are suffering with an increased strain on their mental health today more than ever. How can we best meet the needs of teachers so they can best serve our kids? We're talking about it all. Let's start by better understanding the mental health issues our teachers are facing today. Research suggests that compassion fatigue and secondary traumatic distress is prevalent among teachers, especially those in high poverty schools, and it's a factor in their decision to leave. One study from the National Institute of Health assessed the prevalence of mental health issues among teachers. This scoping review highlights the risk factors associated with stress, burnout, anxiety, and depression. The study found that identifying these risk factors is a significant step toward addressing mental health issues among teachers. 78% of them reported feeling mentally and physically exhausted by the end of the workday. We're going to talk more about some very shocking statistics. This episode is really about addressing the issue. This is a significant problem in our schools today, and we're going to talk about some possible solutions and what some schools and districts are doing to address it. First, there's so many common stressors when it comes to mental health of educators when you think about it. Among some of the reasons that they cited of job stress, many say that teaching has gotten harder since the pandemic. I'm sure we can all agree, even if you're not a teacher, you can just imagine. Student academic needs have gotten greater, behavioral challenges have increased, and substitute and other staffing shortages have continued to plague schools. So if you need a day off, and even last minute you have a breakdown and you need someone to fill in for your classroom and you're not able to find a substitute, these things are just compound the mental health challenges. More than half of teachers said that the mental health and wellness of teachers in their school has declined over the course of 2023 school year. A recent RAND Corp study found that teachers are nearly twice as likely as other working adults to report having difficulty coping with job-related stress. And certainly, students' mental health is impacting educators' mental health. Makes a lot of sense, right? Being exposed to the traumas that students bring into school every day can exact an emotional and physical toll on teachers and other educators. I mean, teachers are not machines. They're not meant to necessarily deflect all of the challenges and the impact, mental health impacts that their students are facing. They take it on as well. More than half of teachers say that the current state of students' mental health is hurting their ability to learn and socialize, as well as negatively affecting the educator's capacity to manage their classrooms. A dozen states allow students to actually take a day off from school for mental health reasons, but the practice is far less common for teachers. In the EdWeek Research Center survey, about half of teachers said that their school or district permitting or encouraging mental health days would support their well-being. But do they do it? No. Most of the time, it's not offered. But some educators aren't interested in more mental health days, in part because that time off is not going to solve the root of the problem, if we're being honest. In fact, Donna Christie, a school psychologist and president of Prince George County's Education Association in Maryland, said, "Having a day off to take care of my mental health to recover from my job is not the answer. The problem is fixing the job so that it's not so stressful that you need to be taught how to cope with it," which makes a lot of sense, right? Who wants to enter into a career where mental health days are built in? I mean, who would be attracted to that kind of a job in the first place? K-12 teachers are the number one most burnt out profession in the United States, with 90% claiming that feeling burnt out is a serious problem. 44% of teachers in K-12 schools report often or always feeling burnt out, and nearly half of U.S. children having experienced adverse childhood events, from poverty and trauma. The rate of secondary traumatic stress among teachers is on the rise, disproportionately impacting teachers in underserved communities. Again, going back to, when you can't control what your students are necessarily bringing into the classroom, but you as a teacher are going to take that on or going to empathize with their situation, that compounds the stress that teachers feel. Teacher burnout is associated with diminished teaching quality, leading to less effective classroom management and decreased student motivation. So this issue isn't even just impacting the teachers, which is bad enough, but it's impacting their ability to teach our kids in the public system. In 2023, 35% of teachers say they're likely to quit and find another job outside of teaching within the next 2 years. And of those, 14% said that they were, quote, very likely, and over half of teachers said that they will leave teaching sooner than originally planned. There are 500,000 fewer educators in the U.S. public schools post-pandemic. Think about that. Just since post-pandemic, so we're only talking about a few years, more than 500,000 educators have quit. 44% of public schools are posting teaching vacancies in early 2022. 43% of educator job postings are going unfilled. 43% of these job postings are going unfilled. That's nearly half. What does that mean? What does that mean for our public system? What does that mean for our kids? But let's talk a little bit about the signs and symptoms of burnout and compassion fatigue among educators. If you know a teacher or you're suspecting that maybe your child's teacher is experiencing this, let's just talk about some of the signs to look for. Burnout is a state of complete mental, physical, and emotional exhaustion. Some of the signs to look for are things like losing the passion or motivation to be a teacher, being easily emotionally dysregulated, so irritability, anger, sometimes sadness, also withdrawing emotionally from coworkers, students, friends, and family, finding it harder to perform regular or basic tasks, just things as simple as preparing a lesson plan, flatness or seeming lack of emotion, difficulty sleeping, and performance issues, sometimes a lack of productivity, so related to feelings of apathy or lack of self-worth or low self-confidence or even hopelessness. Compassion fatigue is a term that describes the physical, emotional, and psychological impact of helping others, often through experiences of stress or trauma. Compassion fatigue is often mistaken for burnout, which really is a cumulative sense of fatigue or dissatisfaction. So some common symptoms of compassion fatigue in teachers include, and some of these are very similar, but struggling to understand your purpose or your goals as a teacher, feeling numb suddenly or detached from your work, excessive sadness and helplessness, sometimes violent fantasies, sometimes ongoing problems with students, administrators, or parents, and blurring boundaries and overworking. The question is, are we implementing enough strategies for preventing burnout and promoting psychological well-being in these high-stress academic environments? A study from the National Institutes of Health found that schools need to prioritize and promote interventions aimed at teachers' personal well-being in order to really effectively combat the current mental health crisis. Testing and implementing the interventions aiming to improve teachers' well-being and ability to cope are extremely important to address stress and burnout, with the expectation that this will prevent or reduce anxiety and depression over time. But district's mental health program for teachers is really sparse. A recent survey by EdWeek surveyed over 1,200 teachers, and in that, the survey indicated that only 2% of teachers from this survey of 1,200 said that their district offers extensive support for employees' mental health and wellness. So 98% of the time, this issue is going overlooked or it's not being addressed within their school. Future studies really need to explore the development, implementation, monitoring, and evaluation of intervention programs for improving mental health outcomes among teachers. If you're an administrator and you're listening to this episode today, please take note of what your organization is doing to help support the mental health and really address the wellness of the teachers that serve our students. In today's age, really, technology can help a lot. So let's talk about some of the interventions that technology allows us. Mobile text technology is an evidence-based, unique, and innovative way. It offers a convenient, super low cost, easily accessible form of delivering psychological interventions to the public, that are experiencing mental health challenges. Mobile text-based programs, they can be easily implemented at the school level to support teachers' psychological needs. We're actually going to talk about a few of those here in a minute. Meditation and mindfulness practices are suggested as beneficial in coping with job-related stress, improving the sense of efficacy, reducing burnout in the teaching profession. And here again is an opportunity for education really to take a page out of what's happening in the corporate side when it comes to corporate employers and what they're offering now their employees with regard to mental health support. And this is certainly an area that teachers are not. They're certainly in a lot of ways probably some of the most mental health challenged than other industries, and yet corporate employers are providing support. So what can school districts learn from that? And how can they best support their teachers? So here are some examples of some programs and initiatives that are meant to promote mental health awareness, specifically for educators. So consider some of these as examples. Wellness for educators. And all of these, by the way, will be in our show notes. So if you want to refer back to some of these examples, there's plenty of resources available to you. So Wellness for Educators, which is edu.org. It's a 501c3 nonprofit led by a team of educators, licensed mental health professionals, and certified mind-body facilitators. All of them are working together to support educators through whole school, research-based, trauma and equity-informed mind-body education practices and strategies for mental, physical, social, and emotional health and well-being. So they provide whole system and kind of choose your own adventure approaches. They could really customize something that's right for your school. That bolsters the schools, districts, community-focused organizations just to cultivate safety, connection, belonging, and resilience for educators, students, and family and caregivers. So check that out if that at all sounds like it might be helpful. Again, the URL is edu.org. Another one is the Calm Meditation and Relaxation app. You might have heard of this, but it's behind what's called the Calm Schools Initiative. It offers teachers access to exercises as well as an onboarding package to introduce mindfulness into the classroom. So if that's something that you feel might be able to, you could broadly introduce to all of the students in your organization, in your school, the Calm Meditation app offers a package for that. So that's something to look into. Another one is the Headspace Mindfulness app. That app has partnered with Teach for America to be available for Teach for America core members and alumni for free. Another is the Happy Teacher Revolution, happyteacherrevolution.com. It's a network of teachers promoting wellness in their communities with both online and virtual training and support group meetings. So again, something specific for teacher support that might be interesting to you. And then CARE, the acronym CARE, stands for Cultivating Awareness and Resilience in Education. It offers programs to help teachers, principals, and other educators develop healthy social and emotional behavior. Truly, a singular approach to quote unquote fix the system it doesn't exist. So it's really rather governments, school boards, and policymakers need to really understand that this issue is important and collaborate with researchers and mental health practitioners on design and implementation of some measures to enhance teachers' mental health, productivity, and their quality of life because they matter. Our teachers and the ability for them to get up in the morning and approach their job in a centered and grounded way impacts not only them, it impacts our students too. If you're listening and you know other mental health resources targeted for educators specifically, please reach out to our team. I would really love to share them in an upcoming episode. I cannot, you know, I can't reinforce this message enough. It's just such an important issue. And anything we can do to provide additional resources to the public, we absolutely want to do that. Prioritizing the mental health of educators, it's got to be a bigger priority for all of us in our communities. Whether you have kids in school or not, building awareness around this issue is critical. And for more details about this topic, please reference the show notes. Like I mentioned before, we have included links to all of the articles that have informed and our episode and other additional resources. If you have questions about how to implement mental health wellness programs for the teachers in your school, please reach out to our team for more information. We would love to help you. We'd love to support you in this very important work, and we respect your dedication and commitment to taking care of those who serve our kids. And that's all we have for you today. Thank you so much for tuning in to this very important episode. Please join us next week for another new episode. And just as a reminder to please review, like, and subscribe.